Hello, friends, and welcome to our frequently asked question and answer session. Let me share my screen. We are having some of the FAQs that I can address today. So, most important question we are having it is what is the difference between clinical research and other type of medical research? So, we are having one most important type of the research, which is clinical research. Usually the physicians from medical student, resident, fellow, and attending are doing this clinical research in form of original study, observational study, or clinical trial. But those are the original studies, and non-original studies writing the reviews and case report. Compared to that, other type of medical research covers basic science research, which is a kind of laboratory research, and translational research, which is a kind of a mixture of bed to bench plus clinical trial to population based implementation research. So those two type of research need extreme different type of skill sets as well as thorough education and funding as well. Compared to that, clinical research is easy and quick to perform, and it's not requiring that much of resources compared to other type of research. So, question number two, what is the difference between original and non-original studies or original and non-original article? Original studies or research is usually observational study or interventional study or meta-analysis of observational study and clinical trials. Those three are the main original study type. And again, observational studies are subdivided into retrospective, prospective, and cross-sectional studies. So those studies where you are collecting, first of all, you are creating the hypothesis. You are having specific method, inclusion, exclusion criteria. You are collecting the data. You are publishing the result. Compared to that, non-original studies are lacking definite methodology and analysis. So those studies are inferior to original studies. So mainly those are the literature review, case report, and later to editor, etc., etc. Now it is most important for early career physicians to understand that publishing only non-original studies are not helpful at all, because if you are having like 15 literature review or 10 literature review on your profile without having any original study, that is showing you are interested in research, but you do not have, it is not going to prove that you are having specific research skill set, which usually the residency and fellowship program require. So when you are doing research with the specific aim of getting into residency or fellowship, make sure you should have original studies, which is observational study, most common observational and quality improvement study, or meta-analysis on your profile, rather than having multiple literature review or case reports without having any original study. Um, the third most common question we are having it is that what are the publication and the type of different medical publications. So usually the publications are having broad three categories: original article, where we talk about manuscript, short communication or research later, or I can say even peer reviewed conference, oral and poster presentation of observational study. Those are the original research. Then another type of peer-reviewed non-original article covers literature review, case report, letter to editor, and third are non-peer review publication, that speech or presentation you are doing at the local conferences or at your hospital or in your grand rounds. So these are the different type of publication. Now, when we are talking about abstract versus manuscript, then usually the abstract is a brief report of your original study, which you are going to present in national or international medical conferences in a form of oral, moderated poster, e-poster, or poster presentation. That will definitely go on your CV as a peer-reviewed publication section, but it is a small part of a full-length article, which we call it manuscript. So manuscript is a 2,000 to 4,000 word of the article, which consists of a small abstract plus introduction, detail, method, result, discussion, conclusion, and tables and figures. Now, uh, only publishing abstract is important, or you require on a beginner level exposure to abstract and manuscript. I feel if you are having opportunity, then you must engage yourself not only in abstract but also in the manuscript, because if you are publishing abstract without publishing manuscript, it will not help you at all, because ultimately the question will arise that you are not completing your project. So in my opinion, if you are starting a project, you are finishing until the abstract level, presenting in the national conference, I must emphasize on completing the manuscript of that project and publish it in a peer review journal. So having experience of abstract and manuscript both are equally important. Publishing many abstract without having manuscript is not a good sign of a good researcher. Now, most important, another question we are having it is what type of peer review conferences usually students attend. So usually the student attend depend on their specialty, many conferences from American Heart Association to American Medical Association conference, and usually 1 to 2 conference you can attend depend on your projects. Now, is it good to attend the conference just with the case report? In my opinion, answer is no. You should always attend the conference with at least some of the original article, not observational study, then at least meta-analysis, which do not require much more intense skill. And if you want to learn more about meta-analysis and other observational study, you can join our clinical research education programs. The videos are and the course detail are mentioned on the top of this Q&As. What is the usual standard duration of a project? It usually take, depend on the project size, but it usually take 3 to 4 months to finish and 4 to 5 months to get it accepted. If it's observational study and you are not doing much data collection, but if you are doing data collection and it's a prospective study, then it can range up to 11 months to 2 years. So yep, you have to take care of the type of the project in the mind as well. We have mentioned the publication process here. What type of skill set you require? You require few different type of skill set: writing the research proposal, understanding of data, collection of data, analytical skill, publication, not publication, sorry, presentation of your data and in form of tables and graph, writing skills, citation skill, submission to the conferences and submission to the journal skill, and publication skill. Some of the analytical tool you require to know is SAS, SPSS, R, or RevMan, comprehensive meta-analysis software, open meta-analysis. Most of the time in university program, you will be having biostatistician, but it takes a longer time if you are having um, you are reliable on some other person rather than you are doing little bit analysis by yourself, then it will be easy. um, if you are planning to do let's say residency or fellowship, it's always good to learn some of the software and basic analytics skill as well. What are the research training we are providing during the classes, whatever I mentioned above, uh, all those training from learning of type of publication and databases, hypothesis generation, and literature review, understanding of database, analytical skill, writing skill, submission skill, and how to respond um, with the proper findings when your article is coming back from reviewer. So those all different skills we are going to teach you during our course. Now, what is the difference between PubMed Index and non-PubMed Index publication? Now, PubMed Index publication are usually basically one must know that PubMed is one of the library, national medical library, where all the journals are a part of that library. Some journals are there, some journals are not there. It takes 3 to 4 years and around 12 to 15 issue to be the part of PubMed, if a journal wants to be. So PubMed is a search engine where you can find out the journal and the article, which is a part of PubMed. Other search engines are Scopus, Medline, Embase, Google Scholar, and if your article is any of this indexed um, mm, index system, then it's a good journal, and you can of course think about publishing there. So two most common libraries are PubMed and Scopus, but mainly you should focus on the digital object identification DOI number of your article so that you can find out it easily. Okay. Now, how will this research help you in the matching process, and how will research help you after being a resident? So research plays very crucial role after USMLE score and US clinical experience in the residency match process. So USMLE scores, once you are having it, that is fixed, we cannot change that score. But this research is some of the research and United States clinical experience, which you can do it, and you can prove your different skill, your clinical skill as well as research skill, in order to make sure that your profile is a good profile in compared to other applicant. But when I talk about the career point of view, the research play a very crucial role before you match and after you match. Most of the program likes people who are having basic knowledge of basic knowledge of creating hypothesis and basic knowledge of publication. Now let's talk about, is research mandatory uh, for only university program, or research is not important in the community program? Now I can take this question in a way that, is research important? Research is important in both programs, whether it's community program or it's university program, but the intensity of research will be different. If you are in a community program, then that research mainly based on data collection from EPIC, observational studies, meta-analysis. We are having many attending from community program who are doing research for their academic achievements. So if you are a part of community program, still research is important. But if you are in a part of university program, then a different skill set of research you will be requiring. And usually those skill sets are, as I mentioned, knowing the softwares, knowing the different type of databases, how to shorten the project duration, and how to efficiently apply the ideas in quality and improvement projects. So research is important, whether you are a residency applicant or resident or fellow, or attending level, it is very crucial. We are having few more questions. what is the cost of publication or executing a project, and how do the research grant funding and budgeting work. So usually the cost of execution or publication varies depend on the size and the resources needed during the process. If it's observational study, then the budget is smaller. If it is QI, you don't have to deal with the much resources, then again cost is smaller. But if you are dealing with some other databases, national database, or you are hiring biostatistician, or you are publishing to some of the open access journal, then cost will little bit go on upper end. So research grant funding and budget is the whole different topic, and we are going to cover that topic in one separate video. Thank you.